Good afternoon, guys. This is B. This is discussion B for you. We're discussing comfort care, which is part of hospice and end of life care. So we're gonna go through that now for you. Okay. Here's a summary of the main points from the article "Comfort Care versus Hospice: Choosing the Right Option" by Anna Georgi. G. G or G. Source. Key difference between comfort care and hospice. Feature: comfort care, palliative care, hospice care. Focus relief from symptoms and stress of serious illness can be with curative care. Treatment: relief during terminal illness phase. Typically no curative treatment. Eligibility: anyone with a serious illness, regardless of prognosis. Terminal illness with prognosis of 6 months or less, certified by a physician. Okay, so when you go to sign up for comfort care, it comes along with hospice too. So when you sign up for hospice and comfort care, palliative care, those kind of deals, has to be signed by a physician. You have to have a terminal illness of 6 months or less. Okay. Creative treatments can be provided by or provided alongside comfort care. Discontinued once no longer beneficial. Services provided: pain and symptom management, treatment options, community resources, 24/7 symptom management, bereavement and counseling services. Duration of care: unlimited, adjusted as needed, typically up to 6 months with possible extension. Insurance coverage may be covered by private public plans, often covered by Medicare, TRICARE, Virginia, and Medicaid, including curative treatments. Care locations: home, assisted living, nursing home, hospital, palliative care facility. Same as comfort care plus hospice specific facilities. Additional insights: comfort care is broader and can be used at any stage of illness. Hospice care is reserved for end of life situations when creative treatments are no longer effective. Both aim to improve quality of life, but hospice is more comprehensive emotional and spiritual support. Would you like to explore how these models align with frailty aware or memory friendly care frameworks? Okay. Absolutely. Comfort care, also known as palliative care, is a flexible, patient centered approach that can be tailored to a wide range of needs and stages of illness. Here's a deeper look into its options and structure. What comfort care includes. Comfort care focuses on relieving symptoms and enhancing quality of life rather than curing the underlying illness. It can be provided alongside creative treatments and is not limited to end of life scenarios. Medical symptom management, pain relief, opioids and NSAIDs and other medications tailored to the patient's tolerance and condition. Symptom control, medications for nausea, vomiting, constipation, diarrhea, insomnia, and breathlessness. Mental health support, antidepressants and anti-anxiety medications and sleep aids, emotional and psychological support, counseling for patients and families, support groups or individual therapy, mindfulness-based interventions and relaxation techniques, spiritual and existential care, chaplain services or spiritual advisors, life review and legacy building activities, support for external stress or grief, multidisciplinary team involvement, nurses or physicians, nurses, social workers, occupational therapists, and sometimes nutritionists or art therapy or music therapists. Care coordination across settings, home, hospital, assisted living, flexible care settings, home-based care, long-term care facilities, hospitals, or specialized palliative care clinics. When is comfort care appropriate? Comfort care is suitable for chronic illnesses like heart failure, COPD, cancer, or neurodegenerative conditions. Patients experience frailty, cognitive decline, or functional limitations. Individuals who want to prioritize quality of life over aggressive treatment, philosophical underpinning. Comfort care emphasizes autonomy, respecting patient choices and values, dignity supporting the person's identity and preferences, holism, addressing physical, emotional, and social and spiritual dimensions. Would you like to explore how comfort care can be adapted for memory-friendly housing or frailty-aware care models? I think your expertise in those areas could lead to some powerful integrations. Comfort care in a home setting is a compassionate, patient-centered approach that allows individuals with serious or chronic illnesses to receive supportive care in familiar surroundings. Here's how it can be effectively applied. Comfort care at home, core components, symptom management, pain relief using oral or subcutaneous or transdermal medications, control of symptoms like nausea, breathlessness, anxiety, and insomnia. Non-invasive interventions such as fans or dysphagia or repositioning for comfort, personalized care plans developed collaboratively with physicians, nurses, and caregivers, adjusted regularly based on patient needs and preferences. Often includes do not resuscitate orders or do not innovate DNI orders when appropriate. Emotional and spiritual support, access to personal care, personal clergy, counseling for patients and family members, legacy building activities, and life and review, family involvement. Liberalize visitation policies, education and training for family caregivers, bereavement support, and funeral planning assistance, environmental comfort, removal of unnecessary medical equipment, e.g., monitors, IVs, quiet, peaceful surroundings with personalized touches, use of comfort enhancing tools like soft lighting, music, or aromatherapy. Who provides the care? Home health nurses for regular check-ins and medication administration. Palliative care specialists for complex symptom management, social workers and therapists for psychosocial support Primary care physicians remain involved in oversight. Benefits of home-based comfort care. Preserves autonomy and dignity, reduces hospitalizations and medical interventions, enhances emotional well-being by staying close to loved ones, aligns with the wishes of many older adults. Over 65% prefer to receive care at home. Would you like to explore how this model could be adapted for memory-friendly housing or integrated with smart technologies to support frailty-aware care? That could be a fascinating direction given your interests. Comfort care at home relies on a thoughtful blend of medical, emotional, and environmental strategies to ease suffering and prompt well-being. Here are some of the most effective symptom management techniques you can apply at homes in a home setting. Medical symptom management, pain relief. Oral medication, acetaminophen, NSAIDs, or prescribed opioids. Topical agents, lidocaine patches or menthol-based creams. Non-pharmacological options, heat packs, massage, or gentle stretching. 2. Breathlessness, dysphagia. Fan therapy, a small fan directed at the face can reduce air hunger. Positioning, upright or semi-flowers position to ease lung expansion. Low-dose opioids for severe cases under medical supervision. Nausea and appetite loss. Ginger tea or peppermint, natural remedies for mild nausea. Small meals, easier to tolerate than large portions. Antiemetics, prescribed medications like ondansetron or metoclopramide. Fatigue, energy conservation techniques, prioritize tasks, and use excessive devices. Scheduled rest periods, balance activity with recovery. Light physical activity, gentle movement to prevent discording. Emotional and psychological support, mindfulness and relaxation, guided breathing exercises, or meditation apps. Progressive muscle relaxation or body scans. Cognitive behavioral therapy are cognitive behavioral techniques, reframing negative thoughts, journaling to process emotions, social connection, regular check-in with loved ones, virtual support groups or teletherapy, environmental and sensory comfort, aromatherapy, soft lighting and familiar objects, music therapy, personalized playlist for mood regulation. Caregiver support and training. Tech caregivers how to monitor symptoms and administer medication, provide emergency contact plans and symptom escalation protocols. I use virtual aids or memory-friendly signage for cognitively impaired individuals. Okay, guys, so that is B for you. I'll be back on shortly with C. Give me a little bit for C, please, and I'll be back on with that for you shortly. For now, Gator Wellness, take care, folks.